The hormone prolactin controls the amount of milk productions in a woman's body, and your body begins producing this prolactin immediately after delivery of placenta. But the high level of estrogen and progesterone affect or suppress the production of this prolactin, thereby causing lower amount of milk production in a woman's body after delivery to breastfeed their baby. Now, because of this, many women have been asking this question: this estrogen and progesterone lowers the amount of milk production in the woman's body. Which other pills or contraceptives are we going to use to avoid the risk of getting pregnant? That's a common question many women, especially breastfeeding mothers, have asked. Now, in this video, we are going to be looking into a special pills. We call it mini pills that a woman should be taking, especially breastfeeding mothers should be taking in order to run away or being protected from the risk of getting pregnant. So in this video, we're gonna be focusing on the breastfeeding mothers, the pills they should be taking to avoid the risk of getting pregnant. So the pill they should progestin only pills. These progestin only pills did not contain estrogen, but it contains progesterone or progestin, which is the normal progestin in a woman's body. Now, the work of these progestin only pills, which we call mini pills, is to thicken the cervical mucus, thereby making it difficult for sperm to pass by. But the question is, what primary work do these progestin only pills have, which we also call mini pills? And the primary work of these progestin only pills is thickening the cervical mucus and thereby blocking the sperm from meeting an egg. That is the primary work of these progestin only pills. Another work of these progestin only pills is that it disrupts the menstrual cycle and thereby preventing the release of egg in the ovary. This is the primary work of these progestin only pills. Now, how effective is this? The effectiveness depends on the users. Now, for those who have used this as prescribed consecutively without any mistake, 99 out of 100 women were being protected from getting pregnant. For you to see how effective this is. Now, another question many people have asked is, why is it that many women, especially the breastfeeding mother, focus on these progestin only pills? Just like I explained in the initial stage, these progestin only pills don't affect breast milk, that is the production of the prolactin, but combined oral contraceptive affect production of prolactin because it contains some amount of estrogen, which these progestin only pills don't contain. And another reason, which is the normal reason why people focus on these progestin only pills, which also include the reason why other women are also taking this combined oral contraceptives, because it helps and protects women from the risk of getting pregnant. Whether you are pregnant or you are not pregnant, you are free to take progestin only pills. When a woman is breastfeeding her baby, especially when the mother is giving the baby exclusive breastfeeding, the chances of the woman getting pregnant is reduced because of the breast milk. Now, coupled with progestin only pills, it will reduce the chances of the woman getting pregnant totally. But in a situation where you are not breastfeeding a baby, that means you need a couple of progesterone and estrogen contents of pills. The common side effect of progestin only pills is changes in the bleeding pattern. These changes in the bleeding pattern include infrequent bleeding, irregular bleeding, frequent bleeding, and prolonged bleeding. In fact, sometimes no bleeding at all. So another side effect of these progestin only pills include headache, dizziness, changes of mood, and also breast tenderness and abdominal pains. So these are the common side effects of this progestin only pills. See, so this progestin only pills is meant for everybody. Free to take progestin only pills. Whether you have children or not, you are free to take progestin only pills. Whether any age background, any age at all is free to take progestin only pills. Whether you have varicose vein or not, you are free to take progestin only pills. And whether you are living with HIV, you are free to take progestin only pills. But there are some necessary things we needed to avoid while taking these progestin only pills, which is not necessary. What are those things we needed to avoid, which is not primarily necessary for us to do while taking these progestin only pills? Some people say that before taking the progestin only pills, you have to do some physical examination or lab tests. There's no routine lab test involved in taking these progestin only pills. Only that you have to avoid unnecessary procedures. These unnecessary procedures include pelvic examination, blood test. You really don't need those things for before you take progestin only pills. And another thing you also need to bear in mind before taking these progestin only pills is that there are some sets of people who really don't need these progestin only pills, or who can be who can negatively be affected while taking these progestin only pills. For example, before you take these progestin only pills, there's some questions you need to ask yourself. If you're having liver disease, kidney disease, heart infections, or any other infections, strong infections, you don't need to go for progestin only pills or combine oral contraceptives. Instead, you have to choose other family planning method, which will be very, very effective. And we have many other family planning methods. Now, there are many people say that how can someone living with HIV take this progestin only pills? Yes, if you are living with HIV, you are free to take this progestin only pills. Whether if you are in antiretroviral therapy or not, you are free to take progestin only pills. But remember, while taking these progestin only pills, use protection, which could probably be condom. I have other questions that many people have asked me about this combined oral contraceptives. But before I answer those questions, I want you to subscribe first for this video. Subscribe. Then if you're done subscribing, then we'll go continue. You are done, right? Yeah, let's look into these questions. Let's look at the first question that someone asked me. The first question is, can a woman who is breastfeeding safely use progestin only pills? This progestin only pills is meant for breastfeeding mothers. So breastfeeding mothers free to use it. Another question that someone asked is, what should a woman do when she stops breastfeeding her baby? Can she continue taking progestin only pills? Yes, she is free to continue taking progestin only pills, but the risk of her getting pregnant will little bit increase. She will not be fully protected, just like when she is breastfeeding. So it is far more better she change to another um, pills, probably combined oral contraceptive. Now, another question is, can a woman take progestin only pills at any age? Yes, a woman is free to take progestin only pills at any age. Then how long does it take to become pregnant after stopping progestin only pills? The Immediately you stop taking progestin only pills, your fertility returns. Now, another question someone asked is also, do progestin only pills cause birth effects or harm fetus? No, it does not cause any birth defect or harm fetus. Now, another question is, do progestin only pills lower sex drive? The answer is no. Progestin only pills does not lower sex drive. Now, another question is, do progestin only pills increase the risk of ectopic pregnancy? No. Progestin only pills does not increase the risk of ectopic pregnancy. So this is all we have for today. In our next video, we're going to be looking into another family planning method. Please stay tuned. Don't forget to subscribe to this video. I remain your friend.